Medicare for All. It's going to kill innovation in the healthcare field. And everything that is good about healthcare is better now than it was 50 years ago because of innovation. It's going to stymie things in two ways. First off, do you really expect a centralized bureaucracy to decide, okay, this is a good cutting-edge way of treating illness? We're going to go ahead with that. The government and bureaucrats in the government in particular, when you have no recourse outside of that system, which is the whole point of Medicare for All, there is no outside, they're not going to be responsive, they're not going to be forward-looking, they're not going to be avant-garde when it comes to new types of healthcare. The other thing, and this goes to Bernie's idea about profit-driven insurance companies, how many of you work for a living? And how many of you work for a wage? You know, talking about stuff as profit-driven is just mere ideological cant. If you take away a drug company, if you take away a doctor's incentive to make money and to come up with new ways of doing things, which is what will happen under Medicare for All because there will be strident price controls on all sorts of activities in the healthcare space, you're going to hurt the ability to try new things and to make money from doing them.
Now, I bring a unique perspective as an entrepreneur and a business person. I operate in the private sector. And let me tell you, the current system is broken left, right, center, upside down, every which way to Sunday. And it's not just broken for the 40 million people who don't have insurance and the 40 million people who are underinsured, who are disproportionately women and people of color. But it's also broken for entrepreneurs, for employers, and for workers. And let me give you a couple of examples. The United States is the only developed economy in the world whose businesses have to compete globally without government health insurance. So when our companies are operating in a global marketplace against companies from Germany or Japan or England, they're competing against companies that aren't responsible for health insurance and therefore can direct more private sector dollars to real innovation that's productive, inventing new products and research and development. Second of all, think about the effect on entrepreneurs. You know, at the top level, people think this is a golden era of entrepreneurship, but it's actually untrue. This is a golden era of people starting companies, but they can't survive more than a couple of years. And the biggest reason is those new companies are crippled by health insurance costs.